Hello everyone, and welcome to day 6 of your training, where we will discuss technology and resources. So today we will be going over the logistics of getting started, so how your first day will kind of pan out. Useful resources that we often use for our calls, the most common helpline calls that we get. We'll talk about the phone system. We will go through the 2 databases that we use to enter cases. We'll check out the cubicles in the helpline, and we'll do a little database and phone practice. So one of the biggest things to remember when you actually start taking calls on the helpline is to ask questions. If you aren't 100% sure of the answer, just ask. We ask all the time still, every day. So never assume that you know the answer. You are not alone, and we are a team. So don't hesitate to ask the people around you questions and talk about the cases if you're just more curious about possible outcomes. All right, logistics. So when you come in, if you haven't done this already, you'll register with HR. You'll get passes for the building and get set up with login information and email. You'll confirm your schedule with Priscilla. You'll get a CSS login to log into your actual computer, and then you'll get your own CHA volunteer email address. And this is really how you should send all communication to clients. So never send anything from your personal email. Always do it from our server here at CSS, and you can't access it from home. So yeah, exactly. So you'll get database logins to the 2 databases, which is enrollment and CHA, and then you'll get familiarized with the resources and cubicles and the desktop areas, and then we will have set up for you a digital folder where you can save all your materials and letters, so things that you send out to clients you can keep there, so you'll always be able to reference back to them if you get a similar call later on, or just if you want to look back over your work in awe of what you've done. What is a day in the life of a volunteer? Well, first things first, you check in with a supervisor on duty that day. It's usually either Priscilla or Kristen. Their name will be written on the diary board right over by the helpline, so you'll know who's there. You log into the phone system, check your email, look out for updates. We send out updates in a volunteer digest pretty regularly, so things that we've seen commonly come in on the helpline, changes that you need to know about, all those cool things come out in the volunteer digest. And then you'll enter your cases. You can either do it throughout the day or at the end of the day. Check in with the supervisor if you see any trends or you just have questions or you want to know things about something. Always ask questions. And then usually, because the helpline closes at 4 o'clock, that's a good time to check in with the supervisor about the cases in case there's anything that needs following up right away before we close for the day. Yeah, so throughout the day, you can work on your case notes, entering the database cases, wait for documents. A lot of times we're waiting for clients to fax things to us, and then just review your cases. So this is a screenshot of the volunteer folder. So we'll talk about how to get to those a little while later, but this is what it looks like, so all your stuff will be there. And now we'll launch into the resources that we have. So one of the most common types of calls we have are for appeals, like insurance company appeals, and we've created some do-it-yourself materials that are really handy for people who are on a first-level appeal. Have you guys already kind of talked about appeals a little bit, kind of, sort of? All right, so we have do-it-yourself packages for first-level appeals that are really useful just to send out to clients. They're ready-made. We also have template letters for common calls that we get on the helpline, so those are ready to go for the more common calls.
Do you take clients through these, or can you put them onto the client?
What's that? I'm sorry, what was it?
Do you take clients through these forms?
If they need it, there's forms, and we'll show them to you a little later.
I'm curious for it, so you will have a hard copy of the do it yourself.
Yeah, so you can kind of see what we're talking about, but they have step-by-step instructions, template letters for the client and for the doctor, and instruction, like pretty thorough instructions on how to walk through an appeal. So we sometimes do have to talk to people about them after we send them out, but generally speaking, for those first level appeals, people can understand the do-it-yourself. We also have a website, a portal that has lots of useful internet links. So if you want to explore a topic, you can go on there and kind of look through what's there now. It looks a little different from these screenshots right now, but the web address and login information is the same. So one of the most common sites that we use here is called Medicare Interactive. You can find answers to all questions Medicare on this website. It's really useful because I'd say a large majority of our calls have something to do with Medicare. So any type of Medicare question you get, if you don't know the answer right away, this is an excellent resource to find it. Another really common website that we use is the Marketplace. So since we get a lot of calls from people wondering about their Marketplace eligibility or what kind of financial assistance they might be eligible for when enrollment comes around, we direct them to this website, or we go on this website and find the information that they need. Of course, the New York State Department of Health website has a lot of information about non-MAGI Medicaid and Medicare savings programs, and then other types of public assistance on here and frequently asked questions, so definitely a great resource. And then one of my favorites is New York Health Access. It has details about things that I think are a little bit more complicated to understand, so like special needs trust, spend down, things like that take a little more understanding, that aren't as basic. The eligibility rules aren't as basic. This website is a really great resource for more information on that, and has like a lot of great consumer information that you can send to people. So in case you guys don't know how to bookmark pages, you can refer back to these slides just to show you how to bookmark on Google Chrome. I like to use Google Chrome because it doesn't matter what computer you're sitting at, as long as you're logging in with your information and you're logged in and you're using Chrome, it's going to save all of your bookmarks there. So you don't have to keep saving them every time you log into a computer. So I'm just going to skip through these and you guys can refer back. So we'll go ahead on to case handling resources. So I talked a little bit about the do-it-yourself package. We only give those out at the first level of appeal. That's really important. If someone's already completed their first level of appeal, the do-it-yourself packet is not appropriate to send to them. So only if they haven't done any of their appeals yet. We have these packets for denials based in medical necessity, emergency room, and out-of-network. So like I said before, these have steps for clients and template letters. So it's pretty easy for them to complete on their own, but we're also here to help if they have any questions. And then we also have some pamphlets with affordable care and prescription information for counties outside of New York City. So for uninsured people living upstate, those are really great resources. We'll talk about the out-of-network do-it-yourself a little bit. So we put together this packet for clients who think that their plan isn't giving them the right reimbursement rate for out-of-network care. So this is for people usually who have out-of-network benefits in their plan. So that would be mostly people with a PPO type plan that reimburses for out-of-network care. It's not for claims that were denied. It's for claims that were covered at the out-of-network rate when clients think that it's too low. Yes?
I had a question, which might help other people.
Sure.
I had
want an appeal and everything. And what had happened was, we had to read the fine print of everything.
Mm-hmm.
What had happened was, the insurance company had sent me a check, and I said, oh, gee, this is like really quick for a check to come. So I read the fine print, I read everything down, and what it did was, is they reimbursed me as going to an in-network doc, meaning they were giving an exception to go out of network, but then the doctor, they billed it as being in-network as opposed to an out-of-network exemption where I was going to get, because I had already paid the doctor, but where I was going to get reimbursed the full amount.
Oh, okay.
So you have to really be careful to read the fine print and clarify exactly how it's, being reimbursed. There's something called an out-of-network exemption, where basically what happens is you're going to be paid 100% of the provider's charges.
Yeah.
Meaning they take an out-of-network provider and say, okay, we're going to make them in-network, then the charges are paid at a lesser level.
Yeah. So depending on your plan, that's going to determine what their out-of-network reimbursement rate is. Usually people sign a contract with their plan agreeing to those rates. But sometimes if there's not an adequate in-network doctor, your plan will pay for an out-of-network doctor the in-network rate. But it's definitely very important to read all the details on those insurance company notices. So a lot of times clients will call us with out-of-network questions, and we ask them to send us any notices that they've gotten from the plan, just so we can understand how they're being reimbursed. So this packet kind of walks people through those steps, and it contains materials that explains to the client how to find out what rate the plan reimburses at, and if they did it correctly. It also includes a template letter about how to fight those charges or negotiate a different rate, and it contains information where consumers can go online and find out what the typical reimbursement rate is for those specific services in their area.
Do the DIYs usually suffice for the clients who call, or I'd be totally lost?
It depends, yeah. Most of the time they do, because we'll show you what they look like soon, but they are pretty thorough, yeah. Priscilla has them here.
So not all of the ones we have, but we have the witness offer, medical debt,
Okay.
medical necessity.
Yeah, so here are some for medical debt. And for
The
medical.
ones that you're referring to.
Okay. Bless you. So you can kind of see medical debt and medical necessity.
And this is that the client has to take and make sure that they have all of the information they need to put this together.
Exactly, yeah. It's kind of like a checklist. This is everything that you need, and make sure you have all this information before you send in your appeal. It reminds people of the timeline that they have to appeal, and it gives them template letters so they don't have to write them themselves. So you can kind of take a quick look at those now, and you'll have a better idea of how much information they do contain. But if a client were to call us back and say, you sent me this DIY and I need a little extra help, we would walk them through the instructions. All right, so yeah, we want to explain, especially with an out-of-network do-it-yourself, you want to explain to the client that appealing on an out-of-network basis is something that's kind of a long shot, because most plans don't cover out-of-network services in the first place. But if their plan does, then chances are they already have a specific agreed-upon rate, and the plan is probably paying that. So if it's in line with what the contract says, then it's going to be kind of a long shot to win that appeal. But of course, they still have appeal rights and can certainly try. Okay, so here's an example of when to use that medical necessity DIY, which you guys should all have in front of you. So Sarah Lawrence is calling from the Bronx. Yeah. She's calling you because she received a denial in the mail from GHI, that's her health plan, for labs that she received that were deemed not medically necessary. She wants to appeal. After asking more questions, you realize that she has not done the first level of appeal. So you send her the DIY medical necessity packet and tell her to call back if she loses. And that's that. And that case can be closed because that's an appropriate scenario in which you would send that medical necessity DIY. Does that make sense?
And that's it? You enter the case and that's it?
You enter the case and the supervisor will...
Answer ask for any documents?
Not for a first level of appeal. If you're certain that it's a first level of appeal, then you can send, and then you've determined what the denial is based in, then you can send the appropriate DIY. And, you know, you always want to review with the helpline supervisor to make sure, especially when you're first starting out. But likely that will be a case that is closed. And we always tell them, look, if you lose that first level of appeal, give us a call back and we'll guide you through the second level of appeal, which is a little more hands-on and it's like it usually goes to a case handler.
So don't send me a draft.
No, it's got template letters, so there's really nothing for them to draft unless the doctor or the client wants to add their own information to those template letters. Yeah, we don't need to see a draft. Okay, so when do we send ER or do-it-yourself packets? So Denzel Washington calls the helpline. We get a lot of celebs on the helpline, guys. Get ready. Denzel Washington, he calls us a lot. He has a lot of questions. So he gets insurance through his employer, and he has Empire Blue Cross Blue Shield. He went to the hospital last month because he had a pain in his stomach. He just received an explanation of benefits from the insurance company that he owes $2,500 for the hospital for that visit. And then the insurance company doesn't think it was an emergency. He does not agree, and he makes $55,000 a year, and he's single. He lives in Brooklyn. So this is an example of why an emergency room do-it-yourself packet would be appropriate, because he went to the ER and the insurance company is saying they don't think it was an emergency. So that template has some information about what he needs to get from the hospital to help him appeal. All right, so we're just going to kind of briefly touch on the phone system because I want to show you guys live in action what it's like. But here's what it looks like, so you can refer back to these slides. Yeah, don't worry about learning it right now. We're gonna do some you know, practice runs, yeah, on the actual phone. So this will just be more for you to reference back when you're actually here taking calls. Okay? So I'm not going to walk through each of these screens because we're going to do it when we go over there. Just remember that they're here if you ever forget anything. And of course, you can always ask us for help. Okay? All right, so I'm going to just get to the helpline. While we are all here, the helpline. So we have one helpline phone number. And yeah, sorry. I'll give you a chance to get. So the only exception would be ICANN. They have their own phone number, so you're not going to really get any calls specifically for that program.
That was the MOPC training you had last week,
Mm-hmm.
and FIDA. So those calls really don't come to us. Sometimes some, but not many, so that's the ICANN.
Yeah, sometimes those calls, people might not have the ICANN number, but they have needs that would be best for ICANN to handle, and we can refer them over if that's appropriate. You'll just talk with the helpline supervisor about that. But for the most part, those calls go straight to ICANN, and on our CHA helpline, we mostly get 3 different types of calls. So we get calls for enrollment assistance, like signing up for health insurance through New York State of Health. We get post-enrollment assistance, which is mostly CHA work, so people who either already have insurance and need help resolving an issue related to that insurance, or they're uninsured and need help getting access to care, or they have Medicare and have questions. It could be a number of different reasons why we get those calls, but they're pretty much anything that's not related to, I want basic information about the Affordable Care Act and enrolling, and I want to set up an appointment. Everything else we call post-enrollment assistance, and that's CHA. And then we get other calls for HITCAP, which is our Health Insurance Tax Credit Assistance Project. So those are people that are calling for basic information about ACA-related tax forms. So you'll get maybe a small training on that in the future, but that's just going to be quick intake and advice, and anybody who has a more complicated question related to those tax forms, you can refer them to me. Okay? Just kidding. Databases. Just wanted to remind you that we're going to talk about the phones more later, so don't forget. All right, databases 101. So we have two databases, CNN and CHA. Each volunteer gets their own database login information. So they're going to be different for each of the databases.
Actually the same.
Oh, it's the same.
The same. Jonathan makes it really simple for everyone. So your CHA login is the same as your CNN.
Oh, how exciting. That's new information. That is fantastic. So you just have to remember one login. How amazing. Okay. So you'll get your own login information, which will be the same for both databases. And your names will be added to a drop-down menu. So anytime you enter a case, you're going to be the intake worker. And I'll show you when we go over the entering cases what that looks like. All calls entered into this. There's usually somewhere where you can put that information in. Why do we want all calls to be entered? Because we want to know who we're helping, what their needs are. Even if it's something really simple and basic, we want to know about it and we want to capture that, A, so we can help resolve, trending issues that are coming in and make, larger impacts on policy and healthcare, but also because it helps to keep us funded. So if we can show how many people we're serving, we can show how important the work that we do is. So when you're entering cases, more is better, but of course, you'll always need to get these basics, their phone number, their name, and address, so that if we need to contact them again, we have a couple of ways to reach them. If they have an email address, include that as well. When you're entering notes, so there's a section to enter in the details of the case, you'll want to include the date of the call and also your name, just so if we have any follow-up questions, we know who to ask. So this is kind of a sample of what case notes would look like. So this is Katie entered this case on January 5th, 2015. And it's about a client called because of prescription drugs. The client is in an HMO through their wife's employer. The plan is fully insured, and the client has already gone through the first level appeal. I asked the basis of denial. The client says medical necessity. I told the client that we need to see all pages of the denial and a letter from the doctor supporting the medical necessity of the drug. They're going to fax materials to CHA, and client knows we'll review and see if we can help her. So I'm going to kind of walk you through why this is a good example of database notes. The intake worker stated the problem right away, so that frames how we're going to look at the case, right? Like, oh, this is the problem when we see the details. They talked about what kind of plan the client has. It's an HMO, so that's going to dictate what the appeal rights are and what kind of coverage they have. We know that the plan is fully insured as opposed to self-insured, so that also impacts the appeal rights. And we know that they've already done a first-level appeal, so we can eliminate the DIY. We know that's not appropriate. We know the basis of the denial is medical necessity, so that's going to determine appeal rights as well. And we want to see all the pages of the denial so we can get a better idea of how long the client has to appeal and what appeal rights the plan included. It's really important, not just the first page. So this is good because the person who took these notes told us exactly what they did and gave us as much information as they could about the case. It obviously doesn't have to be super long, and just give us the details, the basic details. And then they finish the case notes with next steps. The client's going to fax the materials over, so we know what to expect. We're looking for something for that client, and the case will be assigned if it's something we can help her with.
All right.
So these are some common CHA versus CNN database entries. So in the CNN database, you're not going to be using that too often. It's mainly just for people who are ready to enroll. You might be giving them some basic information about the ACA and then transferring them over to a scheduler for an appointment. If they're not someone who's eligible for an appointment and they're not going to enroll, then you're going to want to put them in the CHA database. So really the CNN database is for people who are ready to enroll and you're transferring them over for an appointment, or they're an existing client that we've already helped to enroll, or they're already in that database and we're just adding notes for their case. So 99% of the time you're going to be in the CHA database.
Also, open enrollment is coming, and we anticipate a high influx of CNN-related calls.
Definitely, yeah, because we're going to have a lot of people ready to make an appointment. Yeah, so that'll be starting in November, so we'll probably get some calls, or October, right around the corner, yeah.
For CNN calls, would we take those, or would we test those along with them?
You would take them, do the initial intake, like, after you're ready to make an appointment, like, do you have insurance, what's your income, like, get enough information, and then it goes to Mariah at the point that person needs to make.
Yeah, exactly. So for the CHA database, that's going to be everything else. Appeals, fair hearings and grievances, excuse me, administrative problems with the plan, Medicare, non-marketplace enrollment, so someone who needs to enroll through LDSS, for example, or through Medicare. Debt, hospital license, and then ACA tax form. Pretty much anything that's not ready to enroll through the marketplace. CHA calls and database. So why do people call the CHA helpline? Well, we talked about for post-enrollment assistance, it's usually an individual. So they call, they tell you about, you intake their information and get, write down the details of the case. And either you can give them quick advice and a supervisor can review it and close the case later, or if it's something that needs further assistance, it becomes a case and it gets assigned to someone here. So usually it gets assigned to a case handler here, a helpline counselor, or sometimes the volunteers or interns. So what is the scope of the CHA program? Someone who needs help with marketplace or non-marketplace coverage. They need advice about eligibility for non-marketplace programs like non-Medicare Medicaid, long-term care coverage, Medicare savings programs, etc. Or they need help with medical bills or accessing medical services. Those are handled internally or referred to a network agency if in-person assistance is needed. We don't get too many calls like that, but we do have CHA agencies throughout the state. So if someone needs in-person assistance, it's not necessarily an impossible thing, so keep that in the back of your mind. What's out of scope from CHA? Someone who needs help applying for marketplace coverage, that's CNN. Or someone who needs another type of public assistance. We do refer them to other programs, sometimes within CSS, so just check in with a helpline supervisor to see what's appropriate there. We don't help with family law or immigration law, or out-of-state clients, unless they have New York regulated insurance. So if someone calls and tells you that they live in Florida, don't turn them away right away because they might have a New York-based insurance. That's the first question you want to ask. If not, then it's out of our scope, but we could maybe help see if there's something easily Googleable.
Yeah. So
Yeah.
To the extent that the state has it, and now the consumer assistance program.
Yeah. Exactly. So we can kind of try to refer them somewhere else in their state. So yeah, if it's not as scope of CHA, we refer to another CSS program, refer to a network agency, a non-network agency, or give them an applicable phone number where they can get help. So what is a case for CHA? It's one client or one family. So the one thing you want to determine right away is who is your client and who is the caller. A lot of times someone's calling on behalf of someone else. A parent is calling on behalf of their child. The child is calling on behalf of their parents that they care for. It could be any number of scenarios like that. So you want to find out who's the client. That'd be the person who has the issue, and who's the caller. Could be the client themselves. Could be someone else. Identify one or multiple needs, and identify CHA versus non-CHA needs. So sometimes people have both. And then you're identifying all of the services that they need. It could be multiple things. So common quick cases, needs coverage or needs to stay insured. So this is for non-marketplace insurance options like COBRA that people get for their jobs, non-Medicare, Medicaid, or employer-based coverage, Medicare, Medicare savings programs, EPIC, Extra Help, and LAS. Those are quick cases that you can determine their eligibility by asking them some basic questions and give them advice about those programs. What questions might you ask? What's their household size, their income? Those two things go hand in hand with what sort of eligibility people are based on. People have for certain programs based on their income and their household size. So those are two really important questions to ask for almost every single call that comes into the helpline. Whether or not they're disabled, when did they last work, and what type of work did they do? Those questions are more important for income and trying to find out what they might be eligible for, if their income is varied, or maybe there's particular programs for specific types of work. But generally speaking, the household size, income, and whether or not they're disabled are questions that you have to ask in almost every case.
Do we have scripts for them? I guess these are it.
We do have an intake form that has all of these questions, so you can use that. I still use those forms as a reminder to ask all these questions because they're relevant in almost every call that you get. So it's just that you can walk through it. And not only are they relevant to help people, just to help them with their case and to find out, get that information to give them the best advice, but it also helps us to see who we're serving. So when we put that information in the database, we can identify where people are calling from, income types in different areas, and where we should focus our attention for outreach. So with a medical bill, that's a really common call that we have for people who are insured and uninsured. They still have medical bills. So we want to find out if the insurer is responsible for the bill or the client. So sometimes clients will go out of network when they don't have out-of-network benefits. Sometimes an insurance company incorrectly denies coverage for a bill. We want to find out what the bill is for, if the hospital or facility has any type of charity care, and if the client has already tried to negotiate with the provider. If they haven't, and and the insurance company's not going to cover it, we have that negotiating medical debt do-it-yourself packet that's really useful. Yes?
And another thing might be, when to start out with, is the client should probably call the billing department. Let's say it's at a hospital, for example.
Yeah.
Because I had a situation. When it's at the hospital, what I did was, I called the hospital, I read the denial letter and all of that, and the person that was helping me said, well, here's the ICD codes, here's everything. And the woman said to me, she said, I got your problem right here. They put this, like the last digit was wrong.
Yeah.
And she said, that last digit, you don't think it makes a difference, but boy, does it make a huge difference.
So,
paid
yeah.
or not paid.
That's a really good example. Yeah.
And that's a mistake on their end. So, like what I always do is from experience, professionally, personally, I always check my bill, like thoroughly, and then I call the billing people if there's an issue right away. And then I said, here's my code, here's everything. I read it, and boom, one digit off.
That's a great example. Yeah. So oftentimes we'll end up calling billing departments with a client because they might not have the capacity to do it themselves, and they might be frustrated. So it's really helpful to have someone else call with them. and we know what kinds of questions to ask. And a lot of times it's just an administrative mistake like that, and they can resubmit the claim. So yeah, that's a really important thing. We don't have to take these denials at face value. You want to investigate to see if there's something, you know, maybe it's just a mistake, you know, human error that caused the denial. Yes.
What's the, I guess, the length of time that you have to change a code?
I think providers can submit claims.
But I think that it depends on a case-by-case basis, and sometimes have stipulations, like sometimes they have a year to submit claims, and sometimes they have to be submitted within 90 days. So it's all the time.
Yeah.
So it's a matter of calling the plan to find out exactly, based on that policy, what are the rules.
Yeah, so that's, and if it's been, a lot of times you'll get calls from people who get a bill a year later from a provider. They didn't know that they had a bill, and if it was something like an administrative mistake on the provider's end, a lot of times they'll just write off the charges, and we help them with that. You know, it's not the client's fault. So there's a lot of things to consider when you get calls about medical bills.
We after getting off practice, would we call insurers right away? Would you get documents first? Can you get the documents? Is that something that we'll enter and get back to?
Well, it depends. So you want to ask questions to the client because there could be a number of reasons why they're having a bill. You want to ask them if they got any denial letters from the insurance company, if they got an explanation of benefits that says it's not covered. You want to make sure the provider sent the claim to the insurance company. There's a lot of things, a lot of steps before you start making calls. You ask those questions first. Yes.
Another idea to put in is that as soon as something like that comes in and you encounter that, is to call the physician's office as well, because they'll need to send their paperwork in and make sure all their coding is right. You know, maybe it was like one page they didn't send in, or maybe it was delayed getting sent in. So for them to resend everything back in.
Yeah. So yeah.
Organization and
the first thing we always ask is whether or not the client got any kind of denial or extension of benefits related to the service from the insurance company, because that's going to give us a lot of information right off the bat.
Yeah, the insurance company is really a good place to go because they know exactly what's going on with the claim, and for the denial, or maybe they know everything. And based on that information, we are able to make the next step. Whether we have to call the doctor to tell him he needs to resubmit the claim, whether the courts he submitted with incorrect and he needs to correct them. So the insurance company is like the place to go to get information about the claim. Yeah,
that's always your first step. And then you can, depending on that, take your next step. So if it's something that's being denied, it is a service that's being denied, and we want to find out what type of appeal is appropriate here, and what timeline they have for an appeal, and what level of appeal they're at. So these are all really important questions to ask when someone has a medical bill or a denial, because they have a limited amount of time to appeal. So yeah, when we're helping with an appeal, we want to keep in mind the different types of appeals. We want to let consumers know about the timeline for the appeal process. Send them appropriate do-it-yourself materials. So always be sure to ask the helpline supervisor if you're not sure, especially in the beginning, because all of these types of denials, sometimes they have similar, overlapping issues. Sometimes an ER appeal can sound like a medical necessity appeal, or out-of-network appeal can sound like medical necessity. So you always want to check with the helpline supervisor first if you're not sure, because we don't want to send a client the wrong do-it-yourself materials and they lose that first level appeal for that reason.
Yeah.
And then, it could have been something that was easily resolved at the first level, but they only get 2 internal appeals, so we don't want to waste any of them. So for second level appeals, we always ask the client to send in documents, because we want to see whether or not we can help them in the first place. We want to set their expectations because it might not be something that we can help them with. So we never want to make promises to clients like, oh yes, we'll help you with your second level of appeal and we'll write it for you and we'll do this and we'll do that. So there's a lot of information that we need to see first before we can commit to that. So just, set expectations for clients in that way. Have them send in any relevant material. So notices from the insurance company, their first level appeal, any denial letters that they've received, every page of their appeal rights that they've gotten from the insurance company, and if they have any supporting letters or documents from their physician or hospital, then that's really important as well. And again, just set clear expectations. We don't know if we can help them. We're not promising them anything, but we do want to help them if we can, so have them send in all that stuff. All right, so going back to the CHA database, what does it do? It helps us to identify needs, trends, and issues statewide, and it helps us with our reporting and fundraising efforts. So it's really an excellent tool for us to keep CHA going and to help people on a larger scale. So the information we have is only as good as what's entered. So try to give as much information as possible. Like I said earlier, you don't have to write an essay about every case, but just try to give it, the important details in every case, even if it doesn't seem super relevant at the time, just because you know it in your mind. A person who's reviewing it might not have all of those details that you have. So put in any information that you think is relevant. The database has 3 major pieces to it. So it has a client file, a case file, and then a technical assistance log. So the client file, remember, is the name of the person and their information of the person who has the problem. So it might not always be the caller, but the client themselves. And then they have case files. So for every client we have, let's say John Doe, he might have 3 or 4 different cases in the CHA database. Because he maybe is a return client. We've helped him with a first level appeal, he lost, and that case, we closed that first case, and now he has a second level appeal that we're helping with. Or maybe he called us in 2012 for an issue and called us again in 2015 with a different issue. John Doe's client file will always be there, and you can always open a new case under his client file. And then we have a technical assistance log, which is where we enter information for non-clients. So let's say, for example, we have a social worker who's calling on behalf of their client and they just want some basic information about how a program works. That information will go into our technical assistance log. So a little more info about a case versus technical assistant. A case is an individual who calls with a specific insurance problem, or a doctor or social worker calls with their client's information, and the client will be calling at a later date, so we know that's going to become a case. And a client calls for help deciphering an EOB, and you help call the plan. Technical assistance would be a social worker or doctor calls on behalf of the patient without the patient's info. A service provider is calling for general policy information. Or a client is calling for something that's outside the scope of CHA, like food stamps, public assistance, financial assistance, and you refer them outside of CHA. So we're just going to kind of skim through these, and then we're going to show you guys live how the database works. So this is just what it looks like when you log in, and when these are showing you steps of how to enter a technical assistance case and then how to enter a CHA case. So we're going to do this for real. So just have these slides, as something to refer back to when you have questions. Or if you just want to review them after you've entered a case, it might make a little more sense for you. Some notes about case handling. So data entry and note-taking. Like I said before, we get a lot of return clients, so it's always important to search the database for the client before you enter it. I think it's easiest to enter their phone number. Yeah, because people spell names differently, so you might put in a name and it's spelled totally differently in the database. So phone number is a really good way to search for a client. If they're already in there, then you can just add a new case or add notes to an existing case, and just make sure that if they're a return client, that at the end of the day you let the supervisor know that you added notes to an existing case.
And one of the tally sheets will be able to record, like if you worked for a case that was already open on a previous date, you will be able to note that so that we know to look at the case.
Right. So it makes it clear to put in the case number so we can refer back to it. So once you enter the client's information, you'll enter your case and case notes. So just as a review, that should include the date and time, your name or initials, the problem that the client has, the needs that you identified, and possible underlying causes. What you did, include numbers and names of people you spoke with. So one thing that's really important is when you're calling an insurance company or any other type of agency, always get the name of the person that you spoke with, when you spoke to them, and the number you called to get to them. It comes in very handy, especially if you get wrong information from, say, an insurance company, because we might later on need to make a complaint about that, to give somebody additional appeal rights, for example, and it's really helpful when you have that information. Then you want to identify any next steps or outcomes. So if the case is resolved, list the outcome. If there are next steps, like they're faxing something in or they want to call back from someone else, then you put that in the note. So just always leave the status of the case when you leave it, like what does it need, what does the client expect, and or if you think it can be closed. What are some really common mistakes that happen? Not getting complete contact information. So we always, even if it's something that you think is closable right away, we always need the name and phone number especially, and then also the address or email address or all of the above, just so we have multiple ways to get back to people. A lot of times phones get cut off, phone numbers change, people move, email addresses change. So the more information that you have there, the better. Yeah, we do a lot of follow-up.
Initial intake, and if there's something that's missing, we'll always call back the client to let them know or rectify the piece of advice that was given. So we need that information.
Yeah, and a lot of times the follow-up happens on a day that you're not here, maybe the next day or the day after that, so we can't come and find you and look at your notes from that call, so it's really important to keep it in the database. Not putting in income. That is sometimes an uncomfortable question to ask people, sometimes if it doesn't seem relevant to the call. But like I said before, it's something that it's really useful information for us to have, mainly because it helps us to determine what resources and programs the client might be eligible for. Even if that doesn't seem relevant at the time, it might be something that becomes relevant later on in the case. And more importantly as well, we want to know who we're serving. So again, this is something that helps with our fundraising efforts and to keep CHA afloat. So if someone seems a little uncomfortable with you asking them that question, you can use these two explanations to sort of tell them why you want this information and why you need to know it. And most of the time people are okay with that. And if they're not, that's okay too. You don't have to get that information. But it is really important to get it if you can. And then we want to determine where that income is coming from. So if it's Social Security retirement, we want to know that, or if it's SSI or SSB, those are all very different, and they also determine what kind of eligibility for other programs people have. So it's important to differentiate between the different types of Social Security retirement or Social Security income. And then you'll always want to get what type of insurance they have. And HMO, PPO, or EPO, as you guys know by now, that has a lot to do with what the plan is required to do in certain situations, especially with appeals. And if the client doesn't know, and oftentimes they don't, if they can't see that information on their insurance card, then sometimes you have to call the plan with them to get it, or if they get coverage through their job, sometimes they need to get in touch with HR at their job to find out. And that's the same thing to find out if their plan is self or fully insured. Most people don't know that question, the answer to that question. So that's something that you can call the plan or call their HR with them at their job, or they can find out. But that is important to know for appeal rights as well. And then commonly people will always can select the wrong need. It's easy to do. Coverage sounds like insurance. We use those terms interchangeably a lot, but for the database, especially coverage is insurance. It doesn't mean a service. Like sometimes we say, oh, they were denied coverage of a root canal. Yeah, but really that's a service denial. Coverage denial means they were denied insurance. Okay.
Denied any insurance?
It's like maybe they weren't eligible for a certain program. So like, for example, if someone applied for LDSS Medicaid and they were over the income for that, they were denied coverage for that reason. All right. Okay, so we're gonna go to the database live interaction part of this training. So just refer back to these notes as reference, like a reference guide, and then always check in with the helpline supervisor if you have questions.
Yeah. So you can start.
Yes.
Do this. We will use these same samples, how do you integrate?
Yeah, so we're going to go over to the helpline and practice this live. This concludes the PowerPoint presentation.